Hi everyone, today we're going to talk about Fluid Attenuated Inversion Recovery MRI, also known as FLAIR MRI. A 42-year-old female is admitted to the hospital for mild renal failure. The day after admission, she suffered 3 generalized tonic-clonic seizures, which means the seizure affects the entire brain. Her blood pressure was 190/100. Neurologic examination shows a mild encephalopathy without focal findings, meaning while there was a malfunction of the brain, no impairments of the nervous system was seen to affect a specific region of the body. For the past few days, she has been withdrawn and confused. She has no history of neurologic illnesses. A CT scan, T2 MRI, and FLAIR MRI were performed to examine the brain. Now let's take a look at the CT scan first. This is a non-contrast CT scan of the head in axial projection. In the last 2 images, we can see there are regions of low density bilaterally confined to white matter. This is a T2 weighted MRI scan in axial projection of the brain. The scans show abnormal hyperintensities in the parietal lobe of the brain. These lesions become much more clearer on the T2 scan compared to the CT scan. Finally, let's take a look at the FLAIR MRI image. This is also an axial projection of the brain. There are regions of high intensity in the parietal lobe and occipital lobe. All the scans have shown that the lesions are confined only to white matter, and since vasogenic edema is limited to the white matter, we can come to the conclusion that the patient is suffering from a mild hypertensive vasogenic edema as a result of renal failure. This can be explained by the failure of kidneys to regulate blood pressure, which disturbed arterial cerebrovascular autoregulation, leading to extravasation of fluid into the brain parenchyma. The resulting edema is usually vasogenic and reversible, but may become cytotoxic in severe cases. Out of the 3 imaging techniques, FLAIR is better at detecting white matter lesions such as vasogenic edema than the other 2. You might be thinking about why is FLAIR better at detecting white matter lesions? And that's because this fluid attenuated inversion recovery sequence, aka FLAIR sequence, suppresses the cerebrospinal fluid, which makes CSF to appear dark while the abnormalities remain bright. Now let's take a look at the T2 and FLAIR MRI scans of a patient with multiple sclerosis in axial projection. Multiple sclerosis is pathologically characterized by focal areas of myelin-related inflammation as well as neuronal and axonal loss. The scans show multiple foci of increased signal intensity in the white matter regions. The callosal lesion is seen equally well on T2 weighted and FLAIR images, but the cortical lesion is much more visible on the FLAIR image. In conclusion, we can see that the performance on FLAIR images is superior to that on T2 weighted MR images in the detection of cortical lesions. Now let's take a look at another case. A patient was admitted to the hospital with expressive dysphagia, meaning the patient is having difficulty organizing language. A T2 and FLAIR MRI is then ordered, and the image findings show abnormal increased intensity and fullness in the left middle cerebral artery territory, suggesting that the patient has left parietal infarction. We can easily see that the lesion becomes more apparent on the FLAIR images. But as we all know, you have to take the good with the bad. Now let's talk about some of the most significant artifacts specific to FLAIR MRI. One of the major drawbacks is the longer acquisition time of FLAIR MRI. This is due to the physical nature of prolonged repetition time and echo time of FLAIR sequence to suppress the fluid. There is ongoing research on fast FLAIR trying to reduce the waiting time while preserving the image quality. This is achieved using the fast spin echo FSE pulse sequences. In this axial projection of the brain, we can see there are hyperintensities bilaterally in the occipital horn of lateral ventricle region. This shine-through occurs because of long T2 delay time in some normal tissue. According to American Journal of Neuroradiology, it is presumed that this high signal is caused by distorted inversion pulse because of close proximity between the brain and CSF interfaces. The second artifact is the cerebrospinal fluid pulsatile artifacts. The axial FLAIR image on the top shows hyperintensities in the fourth ventricle, while the corresponding CT scan at the bottom shows no mass lesion, which tells us that the hyperintensity is a pulsatile CSF artifact. And according to a journal article published on Journal of Magnetic Resonance Imaging, the pulsatile CSF flow within the ventricular system on FLAIR images has been documented to occur in up to 72 of the examinations. And this artifact most commonly affects the fourth ventricle. The third one is the hyperintense CSF artifact. The axial FLAIR image on the top shows hyperintense CSF artifacts in lateral ventricles, and the corresponding 2:2 weighted image presents similar flow artifacts. The reasons leading to these CSF artifacts are still under investigation. However, there are several theories in the production of these artifacts, such as the increased velocities of CSF flow through the third and fourth ventricles, and increasing rate of entry of CSF from the lateral ventricles during the inversion delay. In this video, we talked about what is FLAIR MRI and its applications in neurology. We also looked at a few cases to compare between FLAIR and T2 weighted MRI. In the end, we discussed the advantages and disadvantages of FLAIR MRI. Thanks for watching. Hope this video helps you understand FLAIR MRI imaging a bit more.